Hello, everyone, and welcome to today's virtual connection, Maternal Mental Health and Mothering Stress, a partnership between the Alumni Association and the School of Leadership and Education Sciences. We are happy you are here with us today. My name is Kara Marsh-Prophet, and I am the Director of Alumni Operations and Engagement at the University of San Diego. When we were sent home to work remotely in March of 2020, the Alumni Association and campus staff had to pivot to virtual engagement. And while Zoom is no true substitute for being together in person, it has enabled USD to connect with Toreros far and wide. Since then, we have hosted nearly 300 virtual events for our alumni and friends. The mission of the Alumni Association is to engage and enrich the Torero community for life. Today's connection is rooted in the desire to offer meaningful ways for our community to stay in touch and to provide you resources to better your lives. We are utilizing Zoom webinar this afternoon and have activated the Q&A functionality for you to ask questions throughout the program. Anonymous questions are approved for this session. Without further ado, I would like to introduce my colleague, Amanda Gonzalez, who will be sharing an update from our SOLS program and introducing today's featured alumni speaker. Amanda, I invite you to turn on your camera. There you are. Welcome and take it away.
Thank you, Kara. As Kara mentioned, my name is Amanda Gonzalez. I am the Assistant Director of Alumni Relations for SOLS, and I am so happy to have all of you here today, and I'm excited to bring this series to all of our alums. And I'm going to be introducing Amber Rukaj. Amber is a licensed marriage and family therapist and a graduate of USD's Master's in Marriage and Family Therapy program at the School of Leadership and Education Sciences, or SOLS. She has additionally been trained as an early childhood therapist and postpartum doula. She has specialized training in reproductive mental health and is trained in the trauma-informed treatment of EMDR. She is a past president of the Postpartum Health Alliance. Excuse me. She is an AAMFT clinical fellow and approved clinical supervisor. A psychotherapist with over 15 years of experience, Amber has provided direct services, clinical management, and development to mental health programs in the San Diego area. Amber is a well-known expert speaker and a consultant for local organizations on the topics of women's mental health, early childhood, integrative mental health, and telehealth. She has worked for the University of California, San Diego's Department of Obstetrics, Gynecology, and Reproductive Sciences since 2006, where she co-founded and currently serves as the co-director of the Women's Reproductive Mental Health Program. Amber has also operated a private practice since 2006, where she provides counseling to women and their families across California. And she has most recently launched a local business, Spark Mamas, whose mission is to care for women the same way that they care for others. And without further ado, I invite Amber to turn her camera on and get our presentation underway.
Thank you so much, Amanda, for that wonderful presentation. I guess we are ready. I'm going to go ahead and share my screen and we'll get started. And hello, everybody. Thanks for having me on today. Feels a little strange talking to myself and not having people sort of being able to see faces, but I know you're listening. Okay. Right. Today I'm going to be talking about maternal mental health. Today we're going to be going over a little bit of a background information about UCSD's program and a brief overview of what is included in maternal mental health, and looking at some of the current stressors and impact that this is having on women and families. And then lastly, some solutions and tools to manage maternal mental health, which I know most of you are probably interested in the most. So I'm going to try to spend as much time going over coping skills and tools that we can actually use to manage that, and less on some of the kind of background information with that. But just a couple of things in terms of who maternal mental health impacts. When we're looking at any people who we see in our clinic, we're seeing women who are in pregnancy and postpartum, women who are experiencing infertility, women who are experiencing grief and loss related to pregnancy, child loss, or like a medical termination due to a fetal anomaly. We see women who have experienced NICU stays with their babies, women raising children with special health care needs, women raising children with developmental delays, autism, spirited kiddos, fussy babies, women of color, single mothers, divorced mothers, same-sex mothers. We see all of them in different capacities within our clinic. And maternal mental health, when we use that term, it includes anything that women might be experiencing on their transition into motherhood. A little bit about our program at UCSD. As Amanda said, I co-founded the program in 2006. Our program is pretty unique in that it is co-located within the OBGYN and the reproductive endocrinology and infertility clinics. This is a unique program in the sense that pre-COVID, if you came in to get your care at UCSD, essentially you could deliver and see your OBGYN or your midwife and see a maternal mental health therapist or a maternal mental health psychiatrist in the OB clinic alongside your care. The goal of the program was to be preventative in mental health, reduce stigmas around women asking for help and seeking help, and for me to make mental health a normal part of care. I never really quite understood how we could separate out the idea of treating women's bodies and their babies, but not really actually treating the mothers and their family systems, and especially like emotional health as we're transitioning into a really, really major event. Our program was founded and started as a result, unfortunately, of a UCSD employee, a pharmacist who committed suicide. And at that point, UCSD was not doing any screening, was not asking mothers how they were doing, and her death was the impetus for making a level of change within our program. And we've been going pretty strong ever since then. So I wish that it had not come out of something so unfortunate, but it has been something that we really hold space for, knowing that there's lots of women who are suffering and that we're trying to prevent that from happening again. Our program is also unique in that it's a training site. We train MFT trainees, interns, and reproductive psychiatry residents in our clinic. So not only are we providing that care to the actual clients, but we're making a bigger systemic level of change by changing the way that providers are actually learning how to care for mothers, which is really important to all of us. In our program, women are screened during their pregnancy. We use a screening tool called the Edinburgh to initiate a referral to our program. Currently at UCSD, we have 340 births a month, and we average about 100 referrals a month to our program. We typically have significant wait lists to get into our program because we have been there for such a long time, and the providers are really starting to ask mothers about their care and asking them what they need and actually seeking out that care. In our specific program, we will only see women up to 1 year postpartum. We had to start doing this mostly not because mothers don't need care along the spectrum of their journey, but in part because we had such huge wait lists for care and so many mothers who were seeking out that we're trying to focus on the most acute phase of their needs within the OBGYN clinics. We do also offer free counseling to our underinsured and non-insured families, which has been a really important and sort of near and dear to my heart, that these families otherwise probably would not be getting any support, and we're able to provide counseling services not only to them, but also to their partners up to 1 year postpartum. Some current maternal mental health statistics. Depression and anxiety are the most common complication in pregnancy. Women of color and women who live in poverty experience maternal mental health conditions 2 to 3 more times as likely as white women. Women in their childbearing years account for the largest group with depression in the US. The cost of untreated maternal mental health conditions is $32,000 per month per infant pair, or $14.2 billion nationally. There has been a significant increase in PMADs, so you're going to hear me use that term a lot. Typically, we have used the term PPD to describe someone experiencing a postpartum mood disorder. Unfortunately, it doesn't capture the range of postpartum mood disorders, and so we now use the term postpartum mood and anxiety disorders. And since COVID, it has now gone up to 72%, and pre-COVID it was at 15%. It's a huge jump in what we've been seeing. We've been very busy in the last year, as you can imagine, and I'm sure all of you are aware of the major impact of COVID, which we'll get into on mothers in this last year. Statistically, there's 1 in 7 women are going to experience a postpartum mood or anxiety disorder, although currently that's also actually at 1 in 5 as well. Untreated PMADs can lead to multiple negative outcomes for families, including preterm delivery, delays in cognitive and emotional development, and reduced infant-mother bonding. This research started around the same time that I was actually finishing up my grad school training, and was one of the impetuses for me actually shifting into not working with children as much and really shifting into doing preventative mental health care around working with women and families. I was working with children at outpatient psychiatry, at Rady's, and really finding that as I was doing the work with the children, I invariably kept gravitating back towards the mothers and really having conversations with them about their lack of care and mental health and really being neglected along the system and the impact of that on their children. And so really trying to start to gear my work more towards a preventative way to intervene with children. The impact of COVID on maternal mental health. Some of these statistics you guys are probably either feeling yourself or already aware of, but 2 million women dropped out of the workforce since the pandemic. That has had multiple impacts on the family systems in which we are seeing impacts on relationships, impacts on mother stress, impacts on increased usage in alcohol and other substances, increased workload for mothers, and the childcare crisis, which we're all probably aware of as well. 48% of the parents polled said their stress has increased significantly since COVID. 75% of parents polled said they could have used more emotional support than they received. And 77% of mothers said, and 87% were reported sleeping less. 47% of moms said they gained weight since the pandemic, with the median being around 27 pounds. Now, this is a topic I'm not going to cover much today, but body image, eating disorders in women have increased during the pandemic, and certainly in the postpartum period has contributed to a lot of less self-care, time for them to be able to actually feel good about themselves, doing basic things that they maybe previously were doing prior to having been on lockdown. I keep hearing it takes a village to raise a child. Do they just show up? Is there a number to call? I think they can't find me. This is something that we hear a lot about in general as where women are coming in, just their inability to be able to find a community of support, to have a community of support. And certainly this was very aggravated by COVID as well. And that led to some significant mental health issues related to isolation and loneliness that we're going to get into a little bit. Last one, just wanted to give you a little bit of statistics by a study that was done during COVID by Mental Health of America, not necessarily specific to mothers, but looking at mental health in general and the things that were contributing to people having an increased report of mental health, with loneliness and isolation being the #1 issue that people were reporting, past traumas, relationship problems, grief and loss, and financial problems. I'd like, if you can, to take a moment before we transition into the next part of this talk to think about how you actually feel today. How have you felt in the last 2 weeks and in the last 6 months? How do you feel you manage stress? How do you know when you feel stressed, sad, or anxious? And more importantly, where do you feel it in your body? Do you know what your triggers are? And what are your barriers to taking care of you? By the end of the talk, I want you to identify one small thing that you will shift or change that will make you feel better, but doesn't feel like performative self-care and doesn't make you feel guilty for doing. I'm not sure if you've heard the term performative self-care, but it essentially centers around the idea that when we're doing self-care activities, they should making us feel better, not adding one more thing to our list or making us feel more stressed out because we're not doing the things that we feel like we should be doing that would ideally make us feel better, but are adding more stress while we're doing them. The culture of social media contributes to this greatly in terms of mothers making a lot of comparisons about whether they're doing the things that they need to for self-care, and if they're not, making themselves feel bad about it. So really like to be able to have you guys think a lot today about, when we go over some of the coping mechanisms and tools, if there's a way that you can think about incorporating that into your life without it having this performative self-care element related to it. Okay, I'm giving you an example of clients that we typically see and what we would refer to as sort of what real mothering is looking like. Mom is a 35-year-old. She's married with a toddler, 6 weeks postpartum with a new baby. She has a history of untreated PMADs. She's working full-time while caring for her toddler. She's currently anxious, depressed, not sleeping, no self-care, minimal support systems. She's questioning her career. She's feeling disconnected with her partner. She's losing patience with her toddler and then feeling guilty most days for yelling. She feels guilty for not loving, mothering. She feels invisible. She has self-doubts about how she is as a parent. She doesn't like who she's become, holds herself to impossible standards, worries about whether she is doing enough to develop her child, worries about bad things happening, feels alone, doesn't like to leave the house, feels easily overwhelmed by small tasks and decisions, feels like she's forgetting things and dropping balls, feels like she's failing in every area of her life, doesn't feel present in her life with her family, doesn't do anything that's just for her, hates the way she looks, thinks that there's something wrong with her because she can't make the changes in her life she knows that she needs to feel better. This is an example of most of the mothers, either some elements of this or variations of that we typically see. And I would guess that most people can check off at least one of these traits or one of these feelings or emotions that they're experiencing, especially in the last year. I'm going to go over PMADs. So I'm not going to spend too much time on this, but I do want, I know that there were some people who are newly postpartum that potentially might be listening in on this conversation, as well as people who are maybe pregnant, and I want them to be aware of the things that they can sort of be at risk for in the postpartum period. Baby blues, that's one of the most common ones. It's 85 to 90% of mothers experience that. That typically happens within the first 2 weeks. Any symptoms that are persisting after delivery beyond 2 weeks is considered a postpartum mood or anxiety disorder. Baby blues happen typically with the sudden drop of hormones after delivery. Usually looks a little bit like this emotional fragility, crying, tearfulness, but not necessarily feeling sad. And usually after 2 weeks, it starts to kind of dissipate a little bit. Getting into postpartum depression. Postpartum depression can also occur, I should say any of these can occur as well in actual pregnancy. So you can have what's called depression during pregnancy, as well as anxiety during the pregnancy, and those can continue into the postpartum period. But postpartum depression typically looks like a low mood, sadness, hopelessness, helplessness, not feeling attached to baby, often feeling really irritable. It can often sometimes lead to feelings of such hopelessness that we do see women take their own lives or express thoughts of suicide. Postpartum anxiety. That's where you're having constant worry, intrusive thoughts, you can't turn your brain off. I think anxiety tends to be normalized sometimes too much. We generally will say, of course, you're a new mother, you should be anxious. And in fact, sometimes we tend to actually encourage mothers to be more anxious by connecting it to being a good mother, right? The more anxious you are, then the better mother you are because you're preventing bad things from happening. And that's true to a certain extent. What we look at in terms of it being problematic is if it starts to impede your ability to do the things that you enjoy doing. I have mothers who can't get in the car to drive their baby places because they're afraid of something happening when they get in the car, or won't let other people help them because they're too anxious to allow help, to ways that they feed baby, to anxiety and how they care for baby with their own partner. So for me, anxiety is really prevalent and typically leads to mothers actually feeling more depressed at times, but you can have both and or just one. Postpartum OCD is not talked about nearly enough. It typically involves obsessive thoughts, intrusive images, rituals, or avoidance of obsessive stimuli. The people who typically have postpartum OCD often have a history of OCD, but not necessarily diagnosed. Oftentimes when I'm doing an assessment, I might ask a mom if they have any traits of being type A, planners, getting upset when things don't go according to plan, having a hard time getting out of the house because they're obsessively worrying about things. Oftentimes in the postpartum period, with the loss of control we experience with a new baby, these things can turn into bigger problems for them, including having obsessive thoughts or intrusive images of bad things happening to the baby. And they're very distressing to mothers. They can't control the thoughts and they can't control the images that are connected to it. And they often scare mothers very much so. We're not typically worried about these moms harming their babies because they have more sort of disgust about the images that they're having versus the actual harm towards their baby. Postpartum PTSD, typically we see this in the context of having a traumatic birth. And it looks like in the postpartum period, having a lot of tension, hypervigilance, nightmares, flashbacks, replaying over and over again their traumatic experience or their traumatic birth. It can often prevent them from doing things like going back to places where they've had their trauma, going back to the hospital. It can make them very anxious in terms of wondering and worrying if something bad's going to be happening to baby all the time. And both parties, both partners can experience actual postpartum PTSD because if the partner is in the room when delivery is happening, they can be witnessing or observing something, and they can have their own PTSD related to that experience as well. Postpartum PTSD can actually go, can get reactivated in with subsequent pregnancies. It makes people very anxious about having another child. And so in treatment, we work through a lot of those traumatic events and memories in order to desensitize them to the idea of being able to have another child again, if that's with something that they wanted to do. Postpartum psychosis happens to only 1% of the population. It involves delusions, hallucinations, paranoia, and disorganization. These are the stories that we typically read about that are sensationalized on the news, mothers who are either harming their babies, killing their babies, these are typically a risk factor, or as if you have bipolar in your family history or for yourself, and that could be an indicator that you could be at risk for postpartum psychosis. So it's really important for anybody who is either pregnant and or close to delivery to make sure that they're expressing any history of their mental health with their providers so that we can actually be preventative around that care for them. Most postpartum mood or anxiety disorders can begin in pregnancy, and they can typically last up to 1 year postpartum. Although it is not uncommon for me to see somebody who shows up for an intake, who's there with their second child who has an untreated history of postpartum mood and anxiety disorders, as well as if you don't actually get treatment, it can continue up to, I've seen women at 3 years say that they still feel like they've been depressed since they had their first child. So treatment is really, really important, and it's actually really effective. And so it's helpful to, if you're experiencing any of these, to actually seek out some support for that. Just want to make sure that nobody has any questions related to any of that, because I know I went over a lot of information. Children don't need a perfect mom. They just need a happy one. And as you can see in this sort of little comic here, the mom says, I'd like to work full time and also be with my kids full time, and also like to have a unicorn that is also a time machine. And, you know, perfect parenting is something that causes a lot of stress for people. And we're going to get into that being one of the bigger triggers that actually causes mental health issues in mothers and women. Okay. So we're going to go ahead and talk about some of the problems that we see that are impacting mothers' mental health. The first one, as I just mentioned, is parental stress to be perfect. I'm sure most people who are listening to this webinar have experienced some element of feeling the need and pressures around mothering and the need to be perfect. There's a culture of this. We put mothers a bit in a bind where we ask them to do the impossible and put all the pressure on them in terms of being the primary person who's caring for babies. In other cultures, it's not quite like this. We typically raise babies among women or families. And in America, we tend to put that onus on the mothers as being the primary person who's responsible for that, with the support of their partner, but the mother being in a position where they're the expert on the baby and expected to actually really feel like they have to make the perfect choice. And if they don't, then they're responsible for anything that happens around that. Mother's guilt. I've yet in my 15 years at UCSD met a mother who did not experience a significant amount of guilt. Mothers feel guilty for being happy. They feel guilty for being mad. They feel guilty when they yell. They feel guilty when they're busy. They feel guilty when they're not too busy. You get the idea. They even feel guilty for asking their partners to help. They feel guilty when their husbands get up in the middle of the night to help with babies, despite the fact that that's their part of their job as well. And guilt really contributes a lot to mothers not getting the help that they need, as well as not getting the help in terms of from their partners, which then creates a whole other dynamic that we'll get into a little bit. Negative self-talk. It never ceases to amaze me the amount of negative things that mothers say to themselves. And I think until I bring it to their awareness, most of them are drastically unaware of it. So I really encourage you to take some time to think about the things that you do say to yourself throughout the day, how often you're saying them, and if they're kind or unkind. We have a general rule about self-talk. If we wouldn't say it to another mother, we wouldn't say it to ourselves, okay? Martyrdom. The idea of martyrdom is destroying yourself for the sake of others. And that sounds a little bit unlike maybe some mothers, but we see an epidemic of this. It's the idea of doing this what's called intensive mothering. There was a sociologist, Hayes, in 1997, who developed this term intensive mothering. And that's essentially where it's child-centered, expert-guided, emotionally absorbing, labor-intensive parenting. And it's almost like the mothers can become sort of addicted to this self-sacrifice. And in fact, like our culture tends to encourage it, right? We put them up on pedestals the more that they sacrifice. The less they take care of themselves, the better that we think that they're doing as mothers. And so when they do have any time to take care of themselves or they choose to do that, they often feel selfish and they often feel like guilty for doing those things, which then sort of kind of perpetuates the cycle of that. Relationship stress, I'm going to get into this a little bit more in some further slides, but this causes a lot of stress for mothers because they feel a loss in their relationship with their partner. They often feel misunderstood by their partner. They don't feel valued by their partner. They feel angry with their partners a lot, feel resentful. Some of this is tied into division of labor, and some of this is tied into gender differences in parenting and the way that we care for them, and also just time. But the statistics for relationship stress, it declines by 75% after the birth of a baby. And without some support around that, it can continue to get exacerbated as the couple continues to change in age with their child. And I'm going to talk a little bit about some things to focus on with that, although I feel like relationship stress could probably be a topic all in and of itself. I will say since COVID, one of the things we've seen really increase is substance abuse among partners, which is causing a significant amount of stress for mothers and impacting their mental health in a lot of different ways, including having to take up more division of labor, having to take care of their partners, and their partners really being not attentive to their mental health. Work and career. So this can include anything from like transitions back to work if you're a new mom, leaving your job and having to make the decision to do that due to COVID, and decisions about what you should do with your career in terms of a work-life balance. And working in for an employer who's not necessarily always supportive of mothers and families is also a contributing factor. Some additional ones include unhealthy boundaries. Unhealthy boundaries include everything from in-laws to relationships to work boundaries to being able to say no and having a really difficult time with being able to do that. And again, we'll talk some more about that. Sleep. I think I saw that there's a talk on sleep that I probably would highly recommend attending that's happening with this wellness series, because sleep is a huge, huge trigger for mental health, and certainly one of the bigger things that we see impacting mothers' mental health. And I'm also going to talk a little bit about some things to do to address that. Loss is another area that we see as triggering mothers' mental health. Loss comes in the form of loss of identity, loss of relationships, loss of your career. Mothers are having babies much later in life than they used to. And as a result of that, by the time they get ready to actually conceive or they're ready to have a child, they have these fully formulated lives and identities. And they're expected to just transition into motherhood and love every element of that, with very minimal attention paid to the losses that they're experiencing as they're transitioning into this really huge role in which they're letting go a lot of parts of themselves that they previously really enjoyed, or that gave them fulfillment or made them feel competent. And so really not having any attention to that can continue to fester a lot of mental health issues for mothers. Other problems include barriers to asking for help. These can include everything from culture, differences around asking for help, to shame, to lack of support in your area of wherever you're living, and guilt, as we've talked about. Untreated mental health is a huge contributing factor. It's not uncommon for me to see someone coming into our clinic for the first time that this is the first time they've ever had mental health services at all. And in their history, they'll report, I've been anxious for most of my life, but I never did anything about that. I was always able to manage it, or I had depression, or have untreated trauma from childhood, or invariably, there's lots of things that get activated for us as we transition into motherhood around how we were parented, and or any sort of unresolved trauma that can often get activated. And then lastly, external stressors. So this includes everything from financial stressors to COVID, to caring for a child with a healthcare condition, to managing your own parents' mental health or their physical health. This is sort of a broad topic, but each person that we see always has these various external stressors. Husbands losing jobs, husbands having substance abuse, partners experiencing their own trauma or mental health. So this category can be any number of things that fall into that. One I didn't add on here also that I wanted to mention is something called decision fatigue, which we certainly have seen more of an increase of that since COVID. In particular, because mothers are just so tapped out that they get really stressed by having to make decisions. And when they can't make a decision, they feel even more stress because they can't make a decision. And so this cycle sort of tends to perpetuate itself a little bit. Dr. Beck, she is a psychologist, Martha Beck, she wrote that on the one hand, the good woman should be willing to sacrifice herself for the benefit of her family. On the other hand, American women are taught to pursue their dreams and excel personally. And this bind that we see women in consistently plays out for an impact on their mental health. They feel really conflicted about what the right thing is to do, and whether or not they're being perfect enough at doing that. Okay, we're going to look a little bit about the impacts of stress. When parents feel stressed out, they're at greater risk for two types of maladaptive responses. The first is they overreact to their children, so blowing a fuse, getting upset easily, or the second one is becoming withdrawn and emotionally unresponsive. This is true for both men and women, and not just women. And you can have both. Sometimes you can overreact to your child and then feel really like you just need to shut down and you need to disconnect. And that's usually a sign that you're feeling pretty stressed. Mom rage. So I wasn't going to talk about this, but given that one of the things we have seen a huge increase in since COVID is mom rage, I thought that it was a good idea to give it a little bit of attention, especially since mothers feel a significant amount of shame and guilt associated with not being perfect parents, and in particular when they're yelling at their children. Mom rage can happen most immediately in the postpartum period, often related to sleep deprivation and hormones in your system, exhaustion, being overwhelmed, loss of control. But I really have continued to see this into working with mothers with toddlers, mothers with teens. Honestly, I think it can happen at any stage of life. And usually the triggers of mom rage are coming from a place of untreated depression or anxiety, feeling alone, a lack of sleep, burnout, having a physical illness. For example, I have a lot of mothers who experienced significant physical health issues related to their birth, and they have back injuries or they have physical recovery issues, and it really aggravates their ability to be patient with their children. Hangry, lack of time for self, unmet needs, unrealistic expectations, and relationship challenges are all contributing factors to mothers being in a more rageful state. There is a cycle that we typically see with mom rage. The mom's feeling burnt out and stressed, tired, and essentially that leads to rage toward the child or the spouse, which is also not uncommon. That leads to a feeling of guilt, and guilt leads to feelings of depression and anxiety. And feelings of depression and anxiety lead to decreased self-care, and decreased self-care leads to more burnout and stress. And so we continue to see this cycle going around and around and around. Ideally, we'd like to interrupt this at the beginning, decrease burnout and stress so that it decreases the likelihood that we're going to have rage towards our child or our spouse, which then stops this cycle to some extent. But it's not always so easy to be able to control our element of burnout and stress. Tools that we can use to manage mom rage there's something that we talk about that's called name it to tame it. Essentially what this is identifying the emotion that you're actually experiencing. So I feel frustrated, or I feel angry, or I feel helpless, or I feel frustrated. To give it a name allows us to acknowledge what we're experiencing so that we don't continue to have these unmet needs or feeling invisible within our own family systems. And giving that emotion a little bit of space allows it to actually move on quicker versus like staying with us for a longer period of time. We typically really teach moms to pay attention to the cues that their body is giving you. We're so busy multitasking that oftentimes we can't attend to the shifts that we're noticing within our body. Mothers typically notice stress for the most part in their chest area, in their neck and in their shoulders, in their stomachs sometimes. And they can feel it kind of rising within their chest or up into their head. And as you're starting to feel that, it's always a good idea to pay attention to it and then give yourself a timeout before re-engaging with your kid or your baby or your partner. And people not paying attention to that typically leads to sort of an outward expression of emotion that they then feel more loss of control over. Reframing how you see your child's behavior. So instead of seeing your child's behavior as manipulative or trying to purposely cause stress for you, although I know it feels like that sometimes, being able to reframe it as they don't have skills to be able to do what we need them to do, whether that's listening, for example, which is a huge trigger for moms when their children don't listen. Instead of seeing it as my kid's ignoring me, maybe it's that my kid needs a different way of hearing what I need him to do, or maybe I gave him too many commands and he's having a hard time following those. Either way, reframing it as something that's developmentally a learning curve for them will help kind of calm and give us more inner patience related to that. Paying attention to your temperature gauge as it's rising and intervene sooner. So I typically teach moms about using a metaphor of a cup of water as representation of your mental health or your burnout or your stress, whatever word you want to insert. Most mothers are typically, especially over the last year with COVID, their cup of water is all the way to the top. So essentially, if I have a cup of water that's all the way at the top and I have a little bump, all that water is going to spill over. And when it spills over, I can't actually really stop it at that point, okay? So ideally, the goal becomes to empty the water out of the cup as much as we can and paying attention to when that cup starts to rise, so that if we have little bumps, if we have, our kid is not listening to us or dinner didn't go according to plan, that we're not completely spilling over into every area of our life, okay? Practicing self-compassion, which I'm going to talk a little bit about in some of the next slides. Emotional literacy is a term that we use to describe people who are struggling with actually identifying emotions and or even have the words to put to them. It's much more common among males than it is among women, but people will still come in and say, typically they identify maybe 4 to 5 emotions for me. I feel sad, I feel mad, I feel angry, I feel embarrassed, but there's a whole range of them, and you being able to actually identify what you feel not only helps you, but it ends up actually helping your child, because you can start to help them label their emotions, which will teach them emotional regulation, and that will make your life a lot easier. Identifying your own triggers. I had asked you guys to kind of think about what are your triggers. I know for me, if I am hungry, I need to snack fairly frequently throughout the day, it will automatically become like a trigger for me. And I get like much more impatient with my kids as the day wears on if I haven't eaten. And the same is true probably for them as well. The art of repair and apology. So a lot of moms, when they have experienced rage or they yell at their kids or they lose their patience, they then go through this process where they beat themselves up for the fact that they did that. And for me, it's really important actually for children to see their parents as imperfect, for them to see that we have a range of emotions and that we can do something that they really, really need, which is to teach them how to repair and how to have an apology. So it now becomes something that's a teachable moment. So if I have a really icky moment, I'm tired, I'm triggered, I'm not paying attention, and I lose my patience with my children, it's okay for us to then come back and say, you know what, mommy lost her patience with you. I'm tired today. I'm frustrated today, and I'm sorry, right? And I'm working on that. And now can you tell me about can we talk about what happened in this event or whatever it was that we needed to happen? Children need to be able to learn how to do this. And if we're not able to have moments where we're imperfect, it actually doesn't create opportunities for them to learn this really, really important skill. If you have more than one kid, you'll know this is true because your kids will be fighting all the time. It is so crucial for them to learn to be able to have a repair and the ability to be able to apologize to their siblings so that the relationship continues to be optimal. Doing therapy and support groups is obviously also another way to help manage mom rage. Talking to other moms is super helpful in terms of knowing that you're not alone in that experience, because there is a lot of shame associated with it. Okay, and get now into the rest of the coping skills that we typically use for this. I'm not sure if anybody has questions about anything, but I don't have time for self-care. So what can I do that doesn't add one more thing to my plate? It is not uncommon for me to see a mom and they'll get really overwhelmed by the idea of having to add more things to intervene. They all know that if they have self-care, that they feel better. The problem is that it often leads them to feeling more stressed out, which is what we were talking about in terms of the performative self-care. So the things I'm going to talk about are not things that you're going to add to your plate. They're things that you can incorporate in that you're already doing, just small edits and changes along the way. Sleep. This looks at impacts on sleep are probably hands down, especially in the postpartum period, the number one thing that we see that causes postpartum mood and anxiety disorders. And it's the number one thing that will actually help them to feel better related to that. Getting enough sleep and having good sleep hygiene are so crucial. I can't say enough about this. So if you are having a hard time sleeping, I suggest that you either reach out to someone to get some support around that, and or like take a check at your sleep hygiene. I believe there's actually a talk on sleep that will probably be helpful to attend as well if you're having any issues with that. It's not just mother's sleep, though, that's a problem. It's also children's sleep, which directly affects mother's sleep. And so sometimes solutions around your stress can come from a place of bringing in a sleep coach, bringing in like a postpartum doula, bringing in a person that can actually help your child to sleep better, which in turn ends up actually allowing you to sleep better. Oftentimes, anxiety is the biggest impeding factor for mothers getting good sleep. They're usually ruminating, thinking about things. Typically with that, I recommend that mothers have a good sleep hygiene, which includes kind of being really mindful about any social media that you're watching or looking at before bedtime. I usually have a 9 o'clock rule, which is after 9, we don't look at that. I generally recommend some light stretching before you get into bed. Monitoring how much alcohol or caffeine that you're intaking throughout the day also helps with sleep. And I like some of the apps like Calm app. They have sleep stories that are really helpful to listen to and help kind of turn your brain off in a way for you to sleep. And the last thing is to do some thought dumping. So thought dumping is essentially before bedtime, I use like my phone in the note section. I just clear everything out so that I'm not in this place of thinking about and ruminating about things I'm not going to do anything about in the middle of the night or right before bedtime. Stopping your inner critic. Mothers have what I call the shoulds, and the shoulds are the voice that we typically listen to, which is, I should have done this, I should have done that, I should have let them have more time, I should have let them sleep longer. Whatever the shoulds are, they typically are attached to something implying that you did something wrong, or that you made a mistake, or that you failed in some capacity. We have a general rule about the shoulds, which is we don't listen to them, and we don't should all over ourselves. Okay. Boundaries. This is about relationships, work, and social media. Can't say enough about having boundaries around social media. I think most of us learned our lesson with the pandemic and doom scrolling, and being on there for too much time really negatively affected our ability to sleep. It affected our moods. It affected our relationships. So having some boundaries around that. Figuring out where you're going to draw your boundaries with work. What are you going to say yes to, and what are you going to say no to? And relationships with people, right? Sometimes this comes in the form of boundaries with our partner. They come in the form of boundaries with our children. So small boundaries that you can set with your children that help your stress levels include when you're going to the bathroom, lock the door. My kids always try to bust open the door, and started teaching them really early on that the door is shut, respect the boundary, this is my space, and we don't intrude on that, right? And so there's sometimes smaller changes where you can do that, or asking them to wait. Mommy's doing something, I need you to wait, or mommy and daddy are talking, I need you to wait. Those are small boundaries that give us a little bit of our sanity back in different ways. Boundaries with our partner and boundaries with friends. Women really like to say yes and have a really hard time saying no. They feel bad if they say no. They feel like they're letting people down if they say no. And boundaries really allow you to be protective of what very little time you have. So unless it's going to make you feel good, I suggest you say no, okay? Division of labor. Obviously, this has been a hot topic since COVID because there has been a disproportionate amount of work on mothers. Really encourage you to have a conversation with your partner regarding division of labor. There's a wonderful book out called Fair Play that gives you some great ideas about how to shift this. She even has a little card deck that you can use with your partner to identify what everybody's doing within the household and figuring out like what you each are prioritizing and how to best sort of shift that. Okay. Decrease isolation and increase your social support. We learned that loneliness was one of the biggest things that contributed to mental health. Women are really isolated and they can feel alone even when they're having contact with people. So can't say enough about the ability to reach out to other mothers and other people in general, at least once a week, where you're getting out of the house, you're engaging in an activity without your child that feels good, that allows you to use your adult brain. Movement, physical exercise, we know for sure helps improves mood. I think that what I've seen mostly related to this is it feels like it's one more thing that people have to do. So I'm really big on incorporating what you can do and not what you can't do. So maybe you can't go to the gym and exercise for an hour, even though that's ideally what you want to do, but you can do 10 minutes of sit-ups in between appointments, or you can do running around at the park with your kids. The movement really helps with anxiety and it significantly helps with depression. So any amount of that is really helpful, and it doesn't always have to come in the form of a Peloton class or something that you ideally want to do. With coping skills, we also need to take a look at our identifying our triggers, which we've been kind of talking a little bit about, but really think about and take notice for a week. I usually encourage people to step back and be observers of their week and notice when they get triggered. Notice what actually really makes them feel upset, sad, anxious, whether it was your husband didn't acknowledge all the work you put into a project for your kids, or your kids feeling ungrateful, or your kids not listening. Whatever those triggers are, see if you can notice a pattern associated with that will allow you to start to sort of figure out where you can intervene. Practicing self-compassion. This is one of the hardest ones for women. At the end of the talk, there is a resource with a website that I highly recommend that you look at. Self-compassion is a really hard thing for women to learn. It's almost like learning a foreign language. Typically, when I ask them to start practicing self-compassion, they typically come back and say, yeah, it just wasn't for me. And so I now know that it just makes them feel really uncomfortable. They're not used to actually giving themselves permission to be nice to themselves. And so it takes a while to learn how to do this, but starting that process now also helps because you're modeling that for your kids, right? I have a daughter and I want for her to know how important it is that like she has self-compassion for herself and that I'm doing that as well and that we're not being unkind. Asking for help and the expression of needs. This happens in terms of communication, most often between partners, where the mom might need more help, but she's not asking for that help, or she feels like if she asks for the help, she's not going to get the kind of help she needs, and so she just stops asking for that help. I really encourage you to continue to have an expression of needs, and if your partner is not able to help you with that, or the people around you, then we find another way to get that need met with people who are able to do that. Making comparisons. I think you probably are aware that this is not helpful for us. I typically see mothers, they'll say things like, oh, well, all the other mothers seem like they have it together, or all the other mothers seem like they're so happy, or all the other mothers have husbands who are giving them flowers on Mother's Day. And I really, really, really caution you around making a comparison about people's lives that you know nothing about, because the images that we see or the stories that we tell are often not what's really happening behind the scene. And unless you have a mom friend who has the exact life that you have, you can never make a direct comparison between your child and their child. You could have a child who has autism. It's very different, your mothering experience, than a mother who has a child the same age, but their child doesn't have autism. And so that comparison is never going to match up for you. A dichotomy of emotions. This is the ability to be able to start practicing making space for more than one emotion in the same space. And this is pretty prominent within mothering. So it's not uncommon for mothers to experience both a feeling of exhaustion and elation in the same space, or feeling happy and elated and joyful about their baby, and at the same time wanting to run away. You can feel really happy to see your kids, and in the next minute feel like you're going to kill them. Okay, this dichotomy is existing constantly within the same space. And what happens is moms typically make themselves feel really, really, really bad if they have any negative emotions. Negative emotions don't say anything about you as a mother. Okay, it's a normal reaction to have a negative emotion about things that are difficult or hard. Similarly to if I put an onion to your eye and I told you don't cry, you're a bad person because you're crying, you wouldn't be able to prevent yourself from doing that. When we're in this confronted with circumstances that are extraordinarily hard, like mothering, it's normal to have those negative reactions alongside the positive reactions as well. And it can feel very like we're almost bipolar in some instances. Like 1 minute we're happy, the next minute we want to run away. 1 minute we feel guilty, the next minute we feel grateful. And it confuses mothers that those exist in the same space. Focusing on what you can control versus what you cannot. The relinquishing of control is very difficult for mothers, and it takes a lot of practice of being able to do this. In particular, I always recommend starting with your partner, since they are wanting to be involved and need to be involved in the care of children, and relinquishing the control on how they do the care of children and letting them have some expertise in doing that, so that it doesn't put you in a position of being the person who is responsible for that all the time. Okay, I'm just checking time here. Realistic expectations, I'm gonna skip over that one because that's pretty self-explanatory. Time for you to have off time for your brain and your body. I can't say enough about being able to just have downtime where you're not on social media, you're not thinking, you're not doing anything, you're not attending to anybody is really helpful in terms of resetting your mood. Making sure they're checking in around any nutrition or medical health issues that you might have, like thyroid issues, any other like major medical conditions that need attention. Leading with curiosity and compassion helps a lot, especially around parenting. If I take a place of curiosity about the behavior that my child might be having, it allows me to get to a place of compassion about that versus a place of anger and frustration. Having an organization plan. I suggest typically that people sit down the start of their week and get themselves organized in some way, and to actually share that organization plan with their partner through shared calendars, through making your invisible labor essentially visible, allows for your partner to be more helpful, and allows for them to have an awareness of what's really on your plate, and allows us to delegate that in a way that doesn't overwhelm us. Working on your relationship with your partner. This is probably, again, a topic for another time, but the ability to feel connected, to feel loved, to be sort of cared for by our partners is tremendously valuable for women. And typically there's a disconnect for a long period of time in marriages after the birth of a baby because mothers are touched out, they're exhausted, and they just don't have time to take care of their partners in the same way they did. So really spending some time working on your relationship will go a long way in terms of the amount of help you get from them, the amount of stress that you're experiencing, and the support that you have. Couples therapy, I wish everybody had couples therapy prior to having a baby. We highly recommend it, and do sessions with partners before they deliver so that they can focus on their marriage and the things that they need to be focusing on prior to the baby's arrival. But you can start with like some day dates or things like that with your partner. I usually recommend going on a date during the day versus at nighttime because moms are really tired at nighttime and they're just not really that engaged in it. Whereas if you go during the day, you're going to be more likely to have like a joyful moment with your partner and be more alert. Some additional things like less over functioning, which I'm going to skip over for today just in the interest of time because I want to make sure we have some time to talk. And seeking out therapy and medication management. If you do need that, we do have reproductive psychiatrists that work in our program that specialize in prescribing medications during pregnancy and postpartum. And seeking out individual therapy is super helpful, even just an assessment to see like, hey, I need more help, or I'm doing okay. I'm going to go ahead and skip over these other ones just because I see we're almost getting close to time here. And the last couple of slides are resources that you can look up for additional support. Postpartum Health Alliance is a local organization here in San Diego. 2020 Mom is doing a lot of the work around like policy change for mothers. It's really exciting. There's the Marshall Plan that's on the table right now that they're trying to push through that will really help address some of these larger systemic issues like childcare and more support for mothers. Some books that I really like that will be helpful in terms of related either to parenting and or maternal mental health in general. And just remember that self-care is not selfish. And if you have any questions, now is a good time to do that. And Amanda, I think, are you coming back?
Yes. Thank you so much, Amber. We do have a few questions already. Okay. And I noticed that a couple of them touch on autism.
Yeah.
The first one is my son is on the autism spectrum. It can be very exhausting since at times it takes longer for him to get a task done. So she's asking for tips on self-care as it relates to having an autistic child or child on the spectrum. And then there was also a question that came in through today's session about having a child with autism and then also expecting twins shortly. So how to manage that as well.
Okay. So let me see if I can answer the question about autism first. I mean, autism is not my area of specialty, so I'll just say that piece of it in general, but I do work with a number of mothers who have children who were diagnosed with autism after, a period of time. And so I had the option of working with them since they were babies and then transitioning into that diagnosis. As an early childhood therapist, I can't say enough about the fact that your self-care with having a child with autism is absolutely essential. And I know that there are resources that I think have been really impacted by COVID, but being able to have respite, you should be able to get access to respite care, which does help a lot with at least giving you some small breaks, and finding a good provider who can help with some of those pieces of that, I think is really, knowing when you're going to get that break is really helpful for them. I think in the moment when you're experiencing that high level of stress, I think some of the tools we talked about in terms of knowing when you're starting to get to your tipping point and giving yourself permission, as long as your child is in a place of safety, maybe stepping out of that for a minute, 5-10 seconds, gathering your thoughts, breathing, and then re-engaging with your child before continuing that process, because they really, kids with autism can really, really push your buttons. And it's a really hard place to be because developmentally, you know that they're not doing it intentionally and it's not their fault. And so mothers often feel really bad about their reactions and not having the patience to manage them. Practicing a lot of self-compassion, that you're doing the best you can in this moment, is probably going to be your best help in that, and getting a lot of support from like the Discovery Center, and there's other like types of modalities of therapy that are really helpful for children with autism. And then, sorry, what was the other question? So I'm looking here from the question about twins.
So she already has a son with moderate to severe autism, and now she's also expecting twins.
Yeah. So I can't say enough about the idea of you potentially hiring either a postpartum doula or a child nurse, someone that can actually come over if it's possible financially for you to be able to do that, and or having someone even just temporarily in a support system that can come to help you with the twins, especially in the beginning, because twins are exhausting. Over time, they can become a little bit easier in some ways, but the most immediate postpartum period is really difficult. Being very compassionate with yourself around the type of feeding that you're okay doing. I've seen a lot of mothers with multiples really kill themselves with breastfeeding, as an example, instead of giving themselves permission to use bottles or allowing other people to help with those feedings, and really pushing themselves to their brink because they're not, it's just, they're around the clock, like essentially feeding both the babies. So really allowing a lot of help, I think, is going to be a huge piece of that. Let's see here, Shane. What are other resources you would recommend in the community for mothers who are in need of similar services you provide, but are either post 1 year and or on a waiting list at UCSD? I would recommend the Postpartum Health Alliance. They're listed in the resource sheet at the end, and we can send out. Can we send out those resources to Amanda, to people who are interested in them?
Yes, I believe so. If maybe if we get those 2 slides, 2 or 3 slides that you had your resources on separately, we can email out to the participants.
Okay, so I'll email that out to you, but I would recommend for sure that you contact the Postpartum Health Alliance. There's a list of providers on there that have all specialized in the same area that I do, or our team does at UCSD, and they'll help connect you by insurance and also by like location. Yeah. Let's see here. What was the name of the game to play with your husbands about the house rules? Oh, it's called Fair Play. And send you info of psychologists. Yes, so what I would recommend is going to the Postpartum Health Alliance as well for that, because there's a list, there's a directory of therapists listed there that you can reach out to who specialize in maternal mental health. And then let's see here. Since most hospitals don't have excellent resources UCSD does of conducting screening as part of prenatal OB/GYN care, do you have suggestions for how to be proactive with your healthcare provider and seek out mental health referrals during the prenatal and early postpartum period? Yes. So I would, especially if you have a history of any mental health in your from your own either depression, anxiety, bipolar, I highly recommend that you make sure that your provider does know about that, and ask them what resources they do have at their hospital and or like within their system. Most hospital systems have at least a social worker who's able to at least give you additional resources. Right now, the mental health community is pretty compromised because of COVID, and all therapists are working from home right now, which makes it even harder because, like, for me, I have 2 children who are running around somewhere. It's harder to do our jobs, and so they're taking on less people in general. But I would recommend that you reach out to Postpartum Health Alliance or Postpartum Support International. Both of them have a directory of providers who specialize in perinatal mood disorders. And this was the last one. Yeah, the same one was about this next question was about where to get a list of therapists. Right. I'm going to give you my email and send that out to you as well, but it's arukaj@health.ucsd.edu, and you're welcome to email me any additional questions, or if you need support in trying to get connected to somebody. I know it's really hard to ask for help, and then trying to navigate the mental health system is really complicated, so I'm happy to help anybody who needs support around that.
This was awesome. Thank you so much, Amber. And I'm just realizing now that I'm unmuting that I have a nursery rhyme video playing in the background because my 2-year-old is here watching
I think that's probably a great way to end this talk.
Right. Yes. Thank you again for your time and sharing your expertise. I know that so many moms and even dads probably who are listening in really appreciated this information. Amanda, always a pleasure to get to see you. Multiple meetings a week, and thank you for your partnership on this session. I do have a ending slide to show you guys. I mentioned in the beginning of the session that we've hosted roughly 300 virtual programs since we pivoted to virtual engagement last March, and we are not letting up off the gas. So we've talked about this wellness series, and there are plenty of opportunities, including the Improving Your Sleep session coming up, the practical benefits of meditation, so on and so forth. But there are also other opportunities to engage with the Alumni Association, including a tequila tasting class and alumni spotlights and interviews. So lots of ways to stay connected to USD, to support your fellow alumni, and to stay involved with the University of San Diego community. So thank you all again. Have a great afternoon. And one last final thank you to Amber. Really appreciate you and your time and your expertise. Take good care, everyone.